A new study out Wednesday shows that today's kids are slowpokes compared to their parents. Arise News medical contributor Dr. Aletha Maybank is here with that and other stories. And I shouldn't chuckle about it because this is really serious.
It is. This was presented at the American Heart Association conference last week. There were a whole bunch of studies that were looked at from across the world, actually globally, and it noticed that kids are nowadays, as compared to their parents, who were the same age back then, are now 90 seconds. It takes them 90 seconds longer to run a mile than it did their parents. Right, so all the conversations, when our parents said, well, we used to walk, here, we used to walk there, actually is very important, and it really helped their fitness. We are now noticing a 5% decline per decade in fitness ever since the year of 1975. And when you look across several countries in the world, there is a declining of this, or there's a declining of the slowing of the kids. However, in countries like China, the level of fitness is still falling. But I think there's a lot of attention now with physical fitness. Every single week it seems like I present something on, physical activity and the importance of it. And this is just demonstrating that there's still a tremendous need to really encourage fitness among young children especially. And there are a lot of barriers that we're finding. We talk a lot about the impact of video games and how that's been on children and TV and social media. But there's also the importance of talking about what's happening in our schools across the country and policies across the world. And there's so much focus on academics and not really recognizing the importance that our children need to be physically fit in order to be academically fit. And so there's more conversation on the policy side of what we need to do in order to promote physical activity and education among our children.
Yeah, so many benefits as a result of that. It's
Absolutely.
Like a cascade of benefits for the rest of their life.
Everywhere, yes, exactly. Pregnancy we've talked about before, heart disease, you name it.
You name it.
Physical
Obesity,
activity,
which is a big problem with
exactly.
our young people. Yeah, that's important. All right, let's move on and talk about this. We've been reporting this in the news this week and I believe the end of last week, and that is this outbreak of cases of meningococcal meningitis at Princeton University.
Right, so last week they had their 7th case since March. Fortunately, it has been a slow progression, which is not great that it's at the school, but great in the signs that it's not going to, or the belief is it's not going to spread to too many other places. Really, they think it's going to be contained here at Princeton. The latest recommendation by the CDC is that children and the students get vaccinated if you live in the dormitories, whether you're undergraduate or graduate, and if you are an employee and you have some level of disease that can compromise your immune system, that you should also get vaccinated. Now, this is the caveat, is that the vaccination is not approved here in the United States. It's approved over in Europe and Australia. The interesting thing is because meningococcal meningitis, there are actually 6 different strains. The vaccine that we have here in the United States only covers 4 of them, and type B, which is this particular strain, is not covered. And it recently was created actually in those 2 countries and approved in 2013 over in Europe and Australia. So it's a very new vaccine. It took a while to create. And so this is why the FDA is actually more lenient, most likely, in order to approve the vaccine to come over to the United States, because it was already in the process of being approved here in the United States.
Yeah, and it's good news for these kids at Princeton, and it's good news that it's not spreading very quickly.
Absolutely.
Let's move on and talk about our next topic, and that is the survey that found that long-term use of birth control could cause eye problems.
Yeah, glaucoma specifically. They took a survey over the years of 2005 to 2008, asked women about their reproductive and eye health, and found that women who took the pill for 3 years or longer, the birth control pill, were less likely or more likely to have glaucoma than women who did not take the pill or took it for a lesser period of time. And glaucoma is really one of the leading causes of blindness in this world behind cataracts, a very serious disease, affects the optic nerve, which is very responsible for carrying information from the eye to the brain. The exact reason why, not completely sure. They're thinking about estrogen levels. Estrogen levels typically in us, if you're not on birth control, or a woman who's not on birth control, the levels fluctuate. So that's a good thing for the body, potentially for the eye as well. When you're on birth control, it keeps the estrogen levels low, and that potentially may be affecting what's happening with the optic nerve. But a lot of more information, again, research to be done in order to find out exactly what's happening.
And that's what I was going to ask you, is how preliminary is this, and how might this change the use of birth control in women?
I mean, it could have a tremendous potential. I mean, right now it's definitely showing an association, not a causal effect, but definitely an association between the two. But I think there's more to come to learn about the effects of birth control and what it can do for glaucoma.
Yeah, something to keep our eye on, no pun intended. And finally, let's talk about CPR, which is so important. You as a doctor know this, and anybody who's had a heart attack, sometimes the only thing between death and that heart patient is somebody that knows how to do CPR on the spot.
Absolutely. And so again, at this American Heart Conference, they presented information, and I've used this and heard this before in my practice on the public health side. The American Heart Association has a program called Hands-On CPR. And basically, it's where you train community residents. They don't have to necessarily be certified in CPR. We've heard about certification, but that's a longer process. But this is hands-on, a 1-minute training. They did this in an airport in Dallas, and they noticed that those who were trained in CPR compared to those, or in this hands-on training as compared to those who were not, were more likely to be responsive, knew what to do right away, knew to give chest compressions right away. And what they're finding is that chest compressions may be just enough until major help gets there for the patient, as compared to before where you do chest compressions and you do breaths as well, which is what is in certified training, but we're finding maybe chest compressions are just enough.
Okay, and the American Heart Association put out a very clever PSA, so let's play that a little bit, and then you're going to demonstrate for us. Okay, let's take a look.
Remember the 2 simple steps of hands-only CPR. First, call 911. Next, place your hands in the center of the chest and push hard and fast until help arrives.
And remember to push to the beat of Staying Alive.
Can I get a little help?
I love that. It's very, very cute.
Yes.
We have moved locations because we have now in veterinary medicine they call it recessive rover. I don't know who they call it in human medicine.
Actually, in the box they call it Mini Ann.
Mini Ann?
Mini Ann.
Okay.
Yes.
All right.
So
the demonstration that people can get that can be so life-saving is what?
So here's Mini Ann. She's blown up. Say Mini Ann just collapsed over. She fell out. The first thing that you're supposed to do is really find out if this person's going to be responsive. So you shake the shoulders, find out if they're responsive or not. If not, you yell for help. You yell for help and you say, call 911. As soon as you say that, call 911, you start to do chest compressions. You basically take your hand, lock it in this way, place it on the chest, and just start doing compressions. And the whole idea for the song is kind of doing it to the beat of Staying Alive and trying to get that rhythm in your head. You're supposed to go down about 2 inches and up, and not be up any longer than 1 second, but keep on doing chest compressions. Just keep on doing,
do those continuously, so no longer take a break
until help comes. Unless you are already certified in CPR and you know how to do, take the breaths. But the reason for doing it this way is that many people felt uncomfortable putting their mouth to the mouth of somebody else. So this is an opportunity to allow people to just feel like they can still help out, and it actually is very valuable help, because anytime that you're able to get blood throughout the body to make sure that the organs are still functioning, always very beneficial.
Literally life-saving.
Absolutely.
Very important. Aletha Maybank, thank you as always.
You're very welcome.
All right, we'll see you again soon. And you are watching Arise America.